First stage labor dilates the cervix to 10 centimeters, and your job is to relax. Second stage, you get to actively help push baby out. But how do you know when it's time to push? Hi, I'm Melissa Evans. I became a childbirth educator in 2004, and I love my job. I know it's really hard, but important for families to get quality childbirth classes. So here I am offering them on YouTube for free so that it will fit your calendar and your budget no matter where you are. Please know that I don't practice medicine, I'm not a care provider, I'm not a lawyer, so use common sense and talk things over with the professionals that you trust. But for now, let's look at what happens when you're completely dilated. Or at least we hope you are. If you're feeling pushy, it might be a good idea to verify the cervix is completely gone. If the cervix is still blocking baby's head a little bit, it can complicate things. Sometimes it can cause the cervix to swell and block baby in, which is obviously quite counterproductive. And other times pushing can actually push the cervix aside and get it out of the way. So working with your care provider to know what's going on to make sure you choose wisely for your birth is going to be important. Okay, we've already talked about tips on how to push in the episode, how to push and how to not push. But first, it's important to identify when it's time to push. Most of the time, there's going to be an urge, an overwhelming force that you couldn't not do. But sometimes it's a little bit more subtle. So here's 7 things you can look for. Hint number 1 is mom says, I need to push. Oh, that's pretty clear. All right, let's do that. Kudos. Yeah, let's get the baby out. Hint number 2 is mom starts pushing. You'll be able to tell that from the outside by the curved in and holding of the breath. If she's doing this, she's pushing. Okay, make sure care providers know and the right people are in attendance and not overly surprised. Okay. Number 3 is a little bit more subtle. Mom might just start grunting. We are going back to our, hindbrain back here, and it's a lot of work. So grunting is a fair reaction to that. Number 4 is looking a little bit more subtle, but sometimes contractions just space out. Remember how we talked about as labor progresses, the contractions that started far apart and they get closer and last longer and more intense and closer and closer and closer. And then in second stage, they space out again. That's okay. That's normal. In fact, sometimes they completely stop for half an hour or so. Take a nap, rest, be thankful. It might be the last nap you get for a while, so enjoy it. Number 5 is mom might say she needs to have a bowel movement. I know, birth just really isn't glamorous, and you're gonna hear that a few times in this class. But as baby's head descends, it hits a bundle of nerves and triggers the Ferguson reflex, and that feels like it's time to poop. If mom says she needs to use the toilet, you might want to follow her because you might want to keep what comes out. Number 6 falls into the kind of a kickstarting category. If mom went through something that looked like transition and she just cannot relax. Now, as I'm saying that, I'm making the assumption you have been really good about practicing relaxation and you are really good about doing that through the entirety of your first stage, and then just all of a sudden it's not working anymore. That might be a clue that pushing will feel better. So do a test push. If it feels better, there you go. That's what just happened. And finally, number 7 is if we know mom is fully dilated and there isn't quite that urge to push, do a test one. Just give it a try. Your body's way smarter than I am. If it says no, doesn't feel good, don't like it, then stop. Don't do anymore. That's okay. There is no point in pushing without an urge. All it does is make you exhausted, and it's not going to be very effective anyways. But sometimes that will kickstart the urge, and then the urge will take over, and then you won't want to stop. So follow the lead of your body, but that little test one might be a good idea. All right, and here are 5 notes on pushing in general. The first one is baby does this dance to come out. During the contraction, it's like 2 steps forward, and when it's over and the pressure's released, it's 1 step back. So it's this rocking motion to get out, and that's normal and expected. Number 2, for partners, just so you know, it can look a little bit strange. Their scalp gets squished together and is kind of wrinkly. It might look like brains, and I'm sorry, it's not. I promise you, there's a skull, there's a scalp. It's the scalp, it's the skin that's wrinkly, that's all. So just know that if you see that, your baby's fine, everything is fine, that is normal. Number 3 for mom is to ask for a mirror so you can see the progress. That's a really good selling feature after I just mentioned that to partners, right? But anyways, For some moms, being able to see the progress and see what's happening helps them direct the energy where they need it to go. It can be motivating and inspiring. And other moms feel like if they were to see it on top of feeling it and experiencing it, it would make the sensations even that much more intense, so they would rather not. And that's okay. Just know that that's a potential option. Number 4 is along the same lines, actually reaching down and feeling your baby's head before baby is born. For some, it's kind of like completing a circuit, as baby's inside but out and mom, and there's this whole circular thing going on. And it too can be very powerful and inspiring and motivating. And for some, it just feels squishy, and that's okay too. So my suggestion is don't make any firm decisions right now. Just be open to the idea of either one, and if it happens, great, and if it doesn't, that's okay too. And if it's inspiring, super, and if not, then oh well, you tried it, that's okay, life goes on. Number 5 is the dreaded defecation. So many moms are terrified they're gonna poop in labor. Guess what? You're gonna poop in labor, and your doula and the nurses and the care providers, they're going to be ecstatic, because that means you are pushing effectively and the pressure's going in the right area and things are moving. It is a great sign. If someone hasn't seen that before, it's because it's their first birth. It's totally normal. Don't worry, please don't worry. The care provider just wipes it away, has you keep pushing, everything's great. Partners, don't be a jerk. If she's kind of freaking out about this and you happen to notice it, just zip it. Don't say anything. Ignorance really is bliss, okay? Be nice. I hope you feel a little bit more prepared. Give me your thoughts in the comments. Please like this video, share it with your friends, and be sure to subscribe. I'll be posting new classes every week, and I don't want you to miss out. Until next time, know your options and own your birth.